Okay, thank you. Appreciate it. So welcome everyone. As you can see, we're going to be talking about the multiple choice questions today. This information is relatively basic. So for some of you, I hope it's not too boring, but we are going to talk about some of the issues that have to deal with multiple choice questions. And at the very end, we're going to take a look at some new information on maybe testing in the future, some things that you can look forward to. Excuse me. So let's just get started. And before we do, I need to get through all my legal disclaimers. So I have no financial conflict of interest to declare with anything that you're going to see in these presentations. So if you see, for example, a monitor or an AED in one of the slides, and there's no product placement that's occurring here. The material is produced here for educational purposes only. Any opinions or assertions that I make are my own private view. They're not to be considered official, nor do they reflect the views of the University of Texas Southwestern Medical School. The use of the medical school's name does not imply that they have reviewed my slides. They're not required to. It also does not imply that they endorse or approve of the educational format or the content. And then this educational activity is not going to include any discussion of off-label use of any pharmaceutical products or medical devices. So with that, let's just take a look at what we're going to talk about today. So during this lecture, we're going to talk about some of the characteristics of a well-crafted multiple choice question. We're going to recognize the importance of plausible distractors, spend some time talking about reliability and validity, and then towards the end of this, we're going to examine the research that surrounds the optimal number of answer options when you're creating multiple choice exams. All right, so the first thing that I want to do, I want to start off and talk a little bit about the difference between formative and summative assessments. And so generally speaking, these are the two general types of assessments that we provide. So first, the formative assessment, sometimes we call this assessment for learning. It's an ongoing process or guide, not a formal test, and it's aimed at monitoring learning during the actual teaching. Certainly, in a classroom, students should be aware of their competency gaps, their educational needs, the differences between where they are currently and where they hope to be as part of the educational process. And then obviously whatever actions they need to take in order to achieve their goal. The quality of teaching and the learning experiences then are judged by formative assessments. And then based on these judgments, medical teachers sort of adjust their educational materials and clarify any learning outcomes in order for the students to be able to achieve their educational goals. Constructive feedback to the students at this level is critical. And that really forms the basis of this formative assessment, as the name sort of implies. So unlike a formative assessment, summative assessments are there to determine whether or not the student has met the educational goal. This is usually done in the form of an exam. It's usually done at the end of a learning session, whether that is a semester or whether it is the end of the course, but there is sort of this final exam to determine whether or not the student has met the educational outcomes, whether they are fit and have met those particular objectives. So through the summative assessment then, especially that final capstone at the very, very end, you as an instructor, you're assuring to the public that the students have met a minimum standard for the diagnosis and treatments of patients, and that they are deemed, at least in your eyes, to be competent to go and sit for a national certification examination. So one of the things when you're looking at creating multiple choice exams, one of the first things that you have to do is you have to be very clear on what it is that you're trying to accomplish with that exam. Formative exams are about determining if the students are learning the material. When the student sits down for the summative exam, then the learning is over at that point. It's now time for that student to demonstrate knowledge acquisition. So the construction of the items actually can be just a little bit different for a formative exam as opposed to a summative exam. A formative exam doesn't necessarily have to be so formal as a summative exam would, because the purpose of that formative exam, again, is to help the student understand where they are relative to where they want to be, and then they can make the adjustments that need to be made, or you can help them make the adjustments so that they can get to where they want to go. Okay, so we are going to be focusing on EMS examinations, and EMS examinations, like most examinations, are really just an issue of sampling. So one of the purposes of any assessment, both at a formative and at a summative level, is to allow educators to make some inferences beyond the particular problem or the particular assessment items. After the student passes a cognitive exam, for example, the educators may feel comfortable that the student has attained, at least an entry level knowledge or certain mastery level of the subject material, depending upon how you've constructed your exam. As an example, then, is we assume that our graduating class of EMT or paramedic students have mastered that material, at least again for the entry level position, and now they're ready to go sit for a national certification exam and then move out from there on into actually taking care of patients. Now, when you go back to the old education, the national standard curriculum, which obviously doesn't exist anymore, but for decades, the national standard curriculum really just set the educational tone for EMS in this country. And when you looked at that old curriculum for paramedics, it actually contained about 2,200 learning objectives. And if you wanted to be absolutely sure that the student had mastered the cognitive objectives of the course, then the educator could certainly ask hundreds of questions about each one of those objectives. But that's generally not considered to be practical. Even if you think about just asking one question per learning objectives, you'd end up with a final exam that had 2,200 items on it. So instead, most educators will choose 100 or 200 questions and then infer mastery of all of that material based on how they perform in the sample of questions or sample of items that you provide. If the student passes then that final examination, the instructor's inferring comprehensive knowledge based on that 100 questions or 150 or 200 or whatever it is that the instructor's chosen. So in effect, the instructor is making a leap of faith from whatever the number is that are of items that are in that final exam. They're making a leap of faith that this student has comprehensive knowledge of all of the other material. Now, before you as an educator take that leap of faith, you need to determine if you're actually measuring what you think you're measuring. When you see passing grades, for example, does that really mean that the student is actually ready to go sit for the national certification exam and move on into taking care of actual patients? So it comes down to whether you think the scores that you see, if they're measuring what you think they're measuring, are you really seeing the things that you think that you're seeing? And so sometimes our eyes can actually deceive us. So for example, when we look at this sort of matrix here, do the gray dots really exist? And I hope this comes across on the interwebs, because on my computer screen, I can certainly see gray dots at the intersections until I try to actually look at them, and then they seem to disappear. Is the black triangle really here? My eyes seem to tell me that it's there, but is it real? And then finally, how many legs do you see in this elephant? When you start counting them, things seem to be a little off. So sometimes the things that we see may not actually be there. So when we take a look at a final exam score and we try to infer whether that individual is actually ready to be taking care of patients out in the real world, then we can get fooled. If you have an exam that's properly constructed, the leap of faith that you're going to take will be minimal, and you'll be able to feel good about turning your students loose on an unsuspecting public. On the other hand, if the exam is poorly constructed, you may find yourself at the edge of a quite large chasm. And if you jump there, then you're likely going to fail. So let's start talking about measurement error. So no measurement is absolutely perfect. For example, my bathroom scale, it can vary by as much as 5 pounds depending upon where I place it in the room. So you can bet that I place it in the optimal spot so that it gives me the lowest possible weight that I can get. Now, in actuality, I realize that my weight is probably within 5 or 6 or 7 pounds of whatever the scale is actually telling me. But if it's incorrectly calibrated or something happens to the inner mechanisms, then the error could actually be quite large. When you're trying to make important decisions based on measurement results, then you obviously have to be confident in your measurement, that your measurement is accurate. One way to do this is to take many measurements and compare the results. So for example, when you're taking a blood pressures are single measurements that are taken at one particular time. A responsible physician would never diagnose hypertension based on a single blood pressure measurement. Instead, what most primary care physicians would do would be to advise the patient to take repeated blood pressures over a few weeks at various times of the day. And if the patient really did have hypertension, then you'd start to see a trend that those blood pressure measurements, all of them would be elevated. And then you feel confident at that point, or at least the physician would feel confident at that point, that the patient actually does have hypertension and should probably be prescribed a medication. Unfortunately, the measurement procedures that we use in education can't be repeated as easily. You can't give a test several times a week. You can give small quizzes perhaps several times a week, but you're not going to be able to give a very big exam on a regular basis. At first glance, though, we may think when we see a score, in this case a score of 100, that's actually that possesses some great precision. And it's sort of intuitive. If we have a 100-question exam and someone gets 70 of them right, then it's fairly, you're fairly confident at saying there were 70 questions and they answered correctly those 70 questions, 30 of them that they missed, so that the precision of that measurement instrument is very good. And it is true that if you just counting the number of correct answers, then there really is no test error. But remember that the measure, what we're actually measuring here is some ability that we're inferring. We're inferring that the student has some ability based on that particular score. And because of that, we can't be as confident. The number 87 or the number 70 or the number 75 is not nearly as clear when we think about it in terms of the student's ability. We can't be sure, for example, that another student that has the same ability would have obtained exactly the same score. And we can't even be sure that the same student that has that ability would achieve an identical score if the tests were administered on different occasion, different day, under different circumstances. So for this reason, we have to turn our attention to the question of error in test scores. And error, when we start talking about it in a psychometric sense, error is not a mistake. It's not a term that's used to declare that there is a mistake in the testing. What it really means is that there's some uncertainty about the meaning of the outcome. How you interpret that test score is going to make all the difference in the world. And there is some measurement error in that interpretation because of that test. And we have to at least consider that measurement error is clouding our ability to infer information about that score. So classic test theory deals with this through this formula, that the observed score is what the student actually scores on the test. That's the big red number up in the corner. That's what the student sees, that's what you see. But that all observed scores are actually a component of the true score, the true sort of ability level of that student, plus some error. Now, the actual error that we see there, that's going to be an unknown all the time, but it is there. And we just have to consider that the observed score is always going to have some error built into it. That error can be increased or decreased based on a number of factors. Okay, so when we start talking then about that error, and what we really would like to get to is the true score, but that's going to be very, very difficult to do. So most of the time, all we're going to have is the observed score, and then we just have to consider the error that is there. Now, there's two subcomponents of the error, of that type of error that fits into the exam. You have those things that are random, the random error, and then you have the systematic errors. So let's talk about random error first. So random error is caused by any factor that randomly affects measurement of the variable across your sample. So in a classroom, for example, the random error is going to be at the student level, something that may be affecting that student. And it could be something completely different, and is something completely different from the student that is sitting next to that individual. So on exam day, for example, some students may come to class, they're hungry, or they're sleepy, they're in a bad mood, and others may have come, they had a really good breakfast, they slept well the night before, and they're in a really good mood at that point. So hunger, sleep, mood, all of those can artificially inflate the observed scores in some individuals while deflating the scores in others. So as we advise our students, what they need to do, especially before that final exam, is to make sure that they have a good breakfast, that they sleep, get some sleep the night before, don't try to stay up cramming and then come to class in a bad mood, because that could actually deflate their score because it introduces a certain amount of error. The important thing to remember about random error is that it doesn't have any consistent effects across your entire sample. Random error is not reproducible. It pushes observed scores up or down randomly, depending upon how it affects the individual. This means that if you could somehow see all of the random error in any distribution and you started to add them up, some of them would increase the score, some would decrease the score. Random errors should, in a distribution, if you add them up, have a sum of 0. Again, there'll be some that will be affected positively, some that will be affected negatively by whatever that random error is. And so an important property of random error is that it adds variability to the data, but it actually doesn't affect the average performance of the group. And so sometimes random error then is considered noise. I refer to it a lot of times as just the noise. That's the background noise of the exam. Now, systematic error, on the other hand, this is caused by any factor that affects the measurement across the entire group. For example, it seems unlikely that any student would actually get a bump on their final exam score in a classroom if you heat that classroom to 90 degrees and have everybody sit in a classroom and take a final exam in a 90-degree environment. There may, through some miracle, there might actually be one student who benefits from sitting in that really, really hot room. But I suspect that in most cases, the scores would actually be affected negatively, and you would be introducing a negative effect on the observed score and actually pulling down the patient's true score down to the observed score level. So when we compare the two, unlike random error, systematic errors tend to be consistently either positive or negative. And because of this, systematic error is sometimes referred or is considered to be biased. Use the term bias. Now, bias is taken on a very negative connotation in the real world. It sort of has some connotations of being a nefarious plot by someone or some organization in some kind of variable. But bias really is just about error. It just means that there is error in measurement. So systematic errors, you can see in this particular graphic here that you have the random error, that individuals are getting off the mark based on individual factors that affect them and only them in one particular way. That same factor may affect someone completely differently. But in systematic error, there's something about the testing process that is affecting everyone in one way or another. Most of the time, it'll either be that everybody gets a bump or everybody's going to get pulled down based on something systematic that's affecting the entire group. And so one of the ways that systematic error can affect students is through poor item construction and the testing environment itself. So that leads us to the reliability and validity discussion. Excuse me. All right, so central to classic test theory is the concept of reliability. In the real world, people associate the term reliable with the term consistent. A baseball player, for example, who makes a hit on average only once every 3 times at bat will nevertheless be called a good hitter, a reliable hitter. Reliability in terms of tests, it's not an all or none concept. You wouldn't say, for example, that a test is either reliable or it isn't reliable. Reliability exists on a continuum. So there's degrees of reliability that a person then or an object is judged to be more reliable than something else. Okay, now reliability is an estimate of how close the observed score is to the actual true score. And most of the time, reliability is expressed as a coefficient. There are mathematical formulas where you can express reliability in terms of a coefficient. And so on many test scoring programs, reliability coefficients can be calculated for you. You could actually do this by hand or on an Excel spreadsheet. It's a little bit more complicated, but you could actually, to the KR20 is not too difficult so that you couldn't do this yourself. But on a Scantron program, the reliability coefficient, the KR20, can be calculated for you. And so once again, remember that this reliability coefficient is on a continuum. Reliability is measured on a continuum. Something would be considered more reliable than something else on that same continuum when the numbers are higher. Now for high stakes exams, something like a national registry or something where major decisions are being made, the reliability coefficients probably need to be somewhere about a 0.9. And then for typical classroom exams, about a 0.7 is where you would need to go. So I would make the argument that for a homemade classroom exam, the higher you can get your reliability, the better you are, the better that the educational experience for the student will be. I would say that if you have a homemade exam and you are testing your students and the reliability coefficients are less than 0.7, then those are exams that need some work. And you're probably not getting where you want to be educationally, and you need to make some adjustments. I would also probably make the argument that if I were going to make final exam decisions, if someone's going to get cut from the program if they don't pass this particular exam, then my reliability coefficient is going to need to be very high so that I would be able to defend that exam. Okay, let's move on to validity. So validity is the extent to which the test measures what it claims to measure. It is vital for a test to be valid in order for the results to be accurately applied and interpreted. Remember that one of the things that we're going to do with these scores is we are going to infer whether our student has met some kind of educational objectives. And so it's vital then for these exams or for there to be some validity in the educational measurement. Now, validity is not determined by a single statistic, but a body of research that demonstrates the relationship between the test and the behavior that it's intended to measure. Validity is not concerned with the assessment questions or the assessment results. It's concerned with your inference and the decision that you make based on the assessment results. Now, historically, what we've seen with validity is a test was considered to be valid if it had things like content validity or criterion-related validity, or construct validity. There were a number of different types of validity that were there. Those validity types have now all been discarded by the standards of educational and psychological testing. And one of the main reasons that happened was because often what you would see when someone was creating a psychological measure and they were trying to express the validity of their measure, if they couldn't come up with content validity, then they would start focusing on criterion validity or construct validity. And so that as long as their psychological assessment tool had one type of validity, then they would consider it to be a valid measurement. So the standards have now discarded that in favor of a better approach. And validity now is, at least by the educational measurement environment, sees validity really as the degree to which evidence and theory support the interpretation of test scores. And so the evidence then for this support comes from things like assessment content, response process, the internal structures, the external variables that are all affecting this assessment measurement, and then the consequences of the testing itself. So when you are creating exams, in order to say that your exam has some validity or that there's some validity to your measurement, then really you have to start addressing some of these issues about the content, about the response process, the structures, and then the consequences of testing. So very specifically, when we get into this, it's how well do your assessment questions, remember once again, you're taking a sample. If you think about all of the possible questions that you could ask about any given, if we take paramedic curriculum, for example, you just have thousands of possible questions that you could ask, but you're pulling a sample of 100 or 200. So how well does that sample of assessment questions align with your learning objectives? How well do those assessment questions in your sample represent the domain of interest? How were those sample questions formatted and written? How were that assessment, how was it administered? How was it scored? Those who have expertise in the content domain can provide some evidence based on content. So for example, a panel of experts can interpret representativeness of the sample of questions to test it for a given cohort of students. So this may be your faculty, for example, that sits around and says, yes, these are questions that a group of entry-level paramedics should know, so that it gives it a little bit more validity than if just one person is making a decision about whether this test is appropriate or not. Okay. So now let's move on into multiple choice items. I know this is sort of the meat of what we're going to be talking about here, but I want to talk just about multiple choice items. And unfortunately, in this short period of time, we don't have enough time to be able to go through, a long tirade on how to write these exams. But I just want to point out some of the characteristics that a multiple choice item might have that make it a really good item. So you all know, the difference between a STEM and your answer item or options and your key, what those terms all mean. So I don't want to get into the weeds here on that kind of stuff, but I do want to talk just a little bit about the STEM. This is the question that you're asking. This is that introduction before you actually give them the ABC options. So the STEM should never be trivial. It should always be focused, and it should ask a direct question. It doesn't make any sense, for example, if I only have 100 questions or 200 questions that I can ask you about the entire domain of everything that paramedics should know, for me to focus on something trivial. I really need to focus that STEM on something that is very, very important. Likewise, I want to make sure that what I'm asking you is a direct question that you could answer as a standalone question. And for that, as an example, once the student reads that question, The student should be able to cover the answer options, read the question, and know in their mind what the answers are, so that when they go down and look at your ABC options, then they can say, yep, that's what I thought. I thought it was this one, and there it is. It's there. A very good, high quality item will, you'll be able to cover the answer options and still be able to make sense. That's what I also mean by focus. So some questions are, you see things like epinephrine is, and then you have 4 statements. Well, if you cover the statements and try to answer the question epinephrine is, well, it is a lot of things. And so that's not a very focused question. It's very difficult for the student, or it makes it difficult for student and introduces some error. All right, the STEM should also be concise, clear, without any irrelevant verbiage. Sometimes I see items that have so much information in them, and then you get down to what the question is actually asking, and it's just a single sentence. I've seen where you have an entire paragraph of like in a clinical vignette, and none of the information in that vignette is relevant to actually knowing what the answer to the question is. So make sure, and all that does again is it introduces some error into your measurement. So be clear, be concise, take out anything that's not relevant to actually knowing the correct answer. When you're writing STEMs for a multiple choice exam, they all should be independent of each other. So by that, what I mean is don't take a question, create a clinical vignette, and have 3 questions that relate to that clinical vignette. And your ability to answer the second question depends upon your answer to the first question. Because once you create your STEMs that way, once you create your items to do that, then if the student answers the first question incorrectly, then the second and the third one are going to be incorrect as well, because the second question may depend upon the answer to the first question. So for example, if you create a clinical vignette, the first question asks to make an interpretation of an EKG. And then the second question asks, based on your interpretation, what would you do? Well, if a student makes an incorrect interpretation, then the second answer to the second question is going to be incorrect as well. So they all need to be independent questions. It again, introduces a certain amount of error when we write them in a different way. Don't give semantic cues in your STEMs so that your students will be able to pick the correct answer, not because they know it, but because the way you constructed the STEM makes the correct answer obvious. And then finally, the STEMs should be directly related to your learning objectives, what it is that you're trying to accomplish in that educational session. Okay, now let's talk about the answer options. So the options themselves, and remember that one of these options is going to be the correct answer, but of your options, they need to be plausible, they need to be logical, focused, and they need to be organized. You should have them free from slang, bias, or jargon, stereotypes that could introduce error, and they could also introduce some legal ramifications for you if someone were to challenge your exam. Make sure that your answer options are grammatically uniform and parallel. So once again, we don't have any cues in here on what the correct answer should be based on the way that the item was constructed. One of the great things to do for distractors is to actually put common learner mistakes. As if you know that students have a misconception about how something works, then make that one of your distractors and see how many of them. The well-prepared students should know that is not true. But those that are only marginally prepared or not prepared at all may just go with what they think they have heard on the interwebs or what they've heard around the water cooler. The answer options should be mutually exclusive with no overlapping content. This is especially true for medication doses, ranges, for example, that you don't have the correct answer that could actually fit within the range that you created for 2 answer options. And you don't want to write items that have all of the above or none of the above. Because there you may not be testing knowledge of content, you may be testing something a little bit different. If you have 4 answer options, and you only are giving the student a choice between A, B, C, and all of the above. If the student recognizes A is true and B is true, then the answer becomes clear. It's all of the above, and you don't even need to look at the C response to know that that's the case. Okay, so now what I hope that most of you tuned in for was to find out how many answer options are enough. I guess I could have given that to you in the first slide, and then we could all have gone to happy hour. But let's take a look at what the evidence shows as far as answer options. So first of all, I think probably the most common form of multiple choice question that we use in classroom exams contains 4 options. So you have a STEM, you have that question, and then you have A, B, C, or D. And the students are asked then to pick one correct answer. Whether you say it specifically or that is implied, I think that that's probably what most Americans are used to, is a multiple choice exam where it's a single option choice. So why do we use that? Well, primarily the reason we do it is tradition. And there is some suggestion in the literature that the primary reason educators use a 4-option model is to reduce the probability that poorly prepared students will be able to guess their way to graduation on an exam. So if you use, for example, a 3-option item or a 2-option item, true, false, for example, that to students, we don't want them guessing their way to success. So let's really look then at the effect of guessing. So what if we took a 30-question exam, a 30-item exam, and we determined that the student has to have a score of 70 to be able to pass? If you're using 4-option format, then the chances that the student is going to answer 21 of those questions correct is 1 in 5 million if they're guessing at each individual. If you bring that down to a 3-option format, then the chances of successfully guessing your way to a passing score is 1 in 33,000. And to put that in perspective, the probability of that student being struck by lightning in their lifetime is 1 in 15,000. So it's not likely that even with a 3-option format on a 30-item exam that a student is going to be able to guess themselves into a passing score. So when you look through the body of research on the effects of guessing, now I don't want to minimize it. There certainly is a guessing effect that comes into play. And if I have a 4-option item, then I have a 25% chance that I can guess the correct answer as opposed to a 33% chance with a 3-option format. But when you then bring that over a 30-item exam or over a 50-item exam or over a 100-item exam, then the chances that the student is actually going to significantly benefit through guessing gets reduced pretty significantly. So more than half a century ago, there actually was some evidence to suggest that if you took the total answer alternatives and held them constant by adjusting the number of items and the number of answer options, that using 3 options per item maximized discrimination, power, and information from a test. Again, if you hold the total answer alternatives consistent. Now, one of the interesting things about this is let's take a look at that, for example, the answer options 4 and the answer options 3. If you have currently a 4 answer option 30-item exam, you can give a 3 answer option with 40 items in about the same amount of time. And notice then again that your total answer alternatives would stay the same. It would take roughly the same amount of time for the student to take that exam, but I could add 10 additional questions. And when you do that, then you maximize the discrimination power and information that you're able to get from that test. All right, so data based on about 7,000 items from a California state personnel board exam concluded that distractors function adequately in about, or I'm sorry, if you have about 5% of test item takers that choose a distractor, then the distractor works. And if they fall below that, then the distractor does not work. And so taking that definition and applying it to lots of different types of high quality national standard achievement tests, one for physicians, for example, they found that only 11 of a 5 option item had those 4 functional distractors. And overwhelmingly in this exam, again, for physicians, that there were non-functioning distractors. And in fact, there were a number of items where none of the distractors actually worked. And individuals were choosing the correct answer. None of the distractors were actually doing their job. So when you go through and you look at the data, what they found is that the number 3 actually gave you the best balance of effort for the instructor, for the individual who actually has to create the exam, for the student that has to take the exam, and the amount of information that you can actually get out of that exam. So that 3 distractors, generally when you look at the literature that's out there today, 3 seems to be the magic number. So how popular is the magic number 3? In one study looking at students, 114 students, they asked them, first of all, when they created the exam, the students didn't think that they would care for the 3 option item format, but once it was over with, they found that 111, I think, voted for the 3 option item as their preferred item. 3 had no preference, and no one voted for the 5 option item. So they seem to be very popular with students. Okay, so now what is the practical argument for this? Well, just from a practical perspective, it does save time for you to create that test as the test writer. If you only have to come up with the key, the correct answer, and 2 additional distractors, that's much, much faster than creating a 3rd distractor. So it will save you some time. Some of the research that's out there as well says that 3rd distractor is a very difficult thing to do, to create properly. And so in many exams, you find that there actually are 2 answer options that work as distractors, and then there's one that does not. And if you have one that's not working as a distractor, then what's the point of even having it there? So if you cut down to a 3 option model, then it also gives you the ability to offer more items per unit of time, which can bump up the reliability of your assessment. So again, there it is. It improves test score reliability, your validity related evidence improves, and the quality of your assessment improves as well. It also gives you, especially because if you can increase the number of items in the same amount of time, then you have increased coverage of your educational domain. Okay, so now for something completely different. So this stuff is that I want to bring to your attention is hot off the presses. Some of you may be aware that just within the past week, there was an announcement by the National Registry concerning the upcoming use of technology-enhanced items. These items will start to appear on examinations this fall as pilot questions for validation. And then once the technology enhanced items go live, the National Registry is going to let everyone know ahead of time, but it is something that you need to start preparing your students for, because again, starting this fall, students who go sit for National Registry exam are going to start to see these items that are going to be functioning as pilot questions. And very similar to the transition from a paper exam to a computer-based exam, students that had never taken a computer-based exam came in with a little bit more anxiety, which introduced a certain amount of error into that measurement. And so now if they start to see items that are constructed and answered differently than what they've done in the past, again, they may have a little bit more error in their measurement. So we need to start preparing our students for this right away. All right, first of all, what does technology enhanced items mean? Well, there's no single definition for what that term means, but generally an accepted definition is that it is a computer-based item that makes use of a format that is not associated with conventional multiple choice questions. So it's really sort of broad, but it is an item that is answered differently than what people are used to, and it is administered through a computer. All right, so let me give you an example. So here's an example of a technology enhanced item. Again, remember that it is going to be administered on a computer. So which elements combine to form water, and select 2 correct answers. So the reason that, that this is, again, called a technology enhanced is because this works really, really well when you can put this on a computer. You can actually do this on a paper-based test as well, but you start to get limited in what you can actually do if you still are giving traditional paper-based exams. What I would recommend at this point is for EMS educators to start off, if you're not already giving exams on a computer, then start off using this. What this is actually called a multiple response question as opposed to a multiple choice question. And you have obviously 2 correct answers. As you start crafting these questions to start putting on your exams, there's a key piece of information. And one of the key pieces of information is that you want to tell the students in your STEM how many correct answers there are. So you wouldn't say, for example, select all correct answers. You want to let the students know that there are 2 of these that are correct, and that when they answer this question, they need to be choosing 2. And of course, we all know what those 2 are. Now notice in the exam that the STEM is focused. It asks a direct question. It doesn't contain irrelevant information and contains no semantic clues. A well-prepared student would be able to cover that answer options and still be able to answer the question. When you look at the answer options, they're all plausible, they're all logical, they're focused, they're organized, and they are grammatically uniform. So this is actually a really good example of a technology enhanced item, especially if you're getting it on a computer. Now, one of the potential ways on a computer that this could even be expanded is, let's say that this type of question appears on an exam, that you have this virtual drug box. So the STEM could paint this picture of an imaginary patient suffering from status asthmaticus. It goes through a lot of information, gives you information about that patient, and then asks you to select 3 correct medication from your virtual drug box. You could then have the virtual drug box for a number of questions. And drug 1 would always be drug 1, drug 2, drug 3, they would all be in exactly the same spot. And then if this were an item that was being delivered by a computer, then all the student would have to do is click on the 3 drugs that would be appropriate in the management of a patient that had status asthmaticus. You pick the 3 drugs, you submit the question, and there it is. Now that's obviously going to be a little bit more difficult if you're doing a traditional paper-based exam, although it is possible to provide the technology enhanced items with Scantrons. You can see, for example, in this case, a Scantron that has 10 answer options, you just wouldn't be able to have 15 or 20 drugs, but you could have 15 or 20 or say 10 symptoms or 10 medications, and the student would choose 2 or 3, depending upon the way that you craft the answer. So this is where EMS educators should start incorporating this information now in multiple response items as soon as you can, so the students can start getting used to it. We've been using multiple response items in our continuing education program for years now, and I really like them. I've always been a big fan of these. Now, some of the advantages of this, this approach, these multiple response, is that it allows you to broaden your construct measurement. You can present more authentic contexts for demonstration of skills and knowledge. You actually are creating something that's much more realistic. When students are actually seeing patients, they're generally not only given 4 signs and symptoms. They have a bunch of signs and symptoms, or a bunch of possible signs and symptoms, and then this is much more realistic. If anyone's concerned about the effects of random guessing, then this is going to reduce that as well. It also reduces construct irrelevance and helps to make things more relevant in your construct, as long as you're creating these items appropriately. Increases the measurement opportunity, facilitates time and cost-efficient scoring, especially on a computer. And it can actually improve test taker motivation through greater engagement. All right, so now the take-home messages for this presentation, and then we'll get to your questions. So formative exams help students identify knowledge gaps while there's still time for them to make adjustments. to be able to pass the course. Summative exams are not for learning. You know, if you create a really good summative exam of 100 questions, that student should never see those questions again. That student should not be going over that final exam. And I realize that historically we've let students see final exams so that they can learn what they missed. But you're really spending a lot of time creating a really good summative exam, and then you're just wasting all that time. You're just giving it away when you let the students sit down and look at it. So rather than do that, you should just provide them and say, here's what you missed. These are the things that you've missed, these topics. And now if you get a second opportunity for a summative exam, these are the things you need to bone up on. Not the individual items, but these are the major concepts that you're having difficulty with. Measurement error, which is caused by poor item construction, can seriously affect the inferences that you make about your students. Reliability is a property of the student cohort, the group. It's not a property of the test. A test is not reliable. It has to be given under certain circumstances. So it's about the group that you gave the test to. Likewise, validity is a property of the interpretation. It's not a property of the test. For traditional multiple choice exams, 3 answer options are generally sufficient. You don't really need that 4th one. You certainly don't need the 5th one. And then technology enhanced items, especially the multiple response items, they offer an opportunity for broad construct measurement, and they're just around the corner. So we need to start getting our students used to it. Okay, so there's my email address. If anybody has questions, they can send it to me, but let's see what we have here for any questions. And Nate, I think you're gonna let me know if there's something.
Yeah, so thank you, first of all, for that great presentation. It's some really awesome information. We did have a great question that you sort of touched peripherally on with the technology enhanced items, but so you mentioned all of the above and none of the above as options should not be used. But what about the select all that apply or multiple response questions? You did mention that those are great options, but if you're using them, if they're going to be implemented, should it be all or nothing scoring, or is it better to use partial points for scoring?
So what you want to do is, instead of saying select all that apply, you want to let them know how many of the correct answers there are. So select 2 that are correct, or select the 2 correct answers or the 3 correct answers. That's a better way to approach it. And then it is an all or none. They either get the question correct or they don't. And in order to get it correct, they have to select the 2 answers. So no partial points for scoring. And in fact, so then when you get into reliability coefficients, so in order to calculate things like a reliability coefficient, those calculations are based on whether students answer questions correctly or incorrectly. So the fact that they have 2 answer options that makes it correct, or 3 answer options that make it correct, ultimately it's just dichotomous. Did the student answer it correctly or did they not? And you're still able to calculate reliability coefficients. The computer, a Scantron would still be able to come up with a KR20 coefficient, even if you have multiple items there that have multiple responses.
Awesome, thank you. And then we had another question. What about negative or accept questions?
So those are great. So negatively phrased questions generally are frowned upon, but there may be some extraordinary circumstance where a negative question would be an appropriate thing to ask. If it were important, for example, for everyone to know not to do something, then that would be an appropriate use of a negative question. But generally, you want items to be positively phrased. Negatively phrased items sometimes force the student to look for something not to do. And that goes against generally what students are, the way that they approach patients. Generally, you approach them on, what do I want to do for this, not what do I want to not do based on that. So try to avoid the negative. And the same thing with accept questions. So it would be, I'm assuming every one of these is true except. So if you're going to have every one of these is true except, then what you have really there is 4 true-false questions. And if that's what you want to do, then just write 4 true-false questions. And then you just have, it's just about, you either answer it true or you answer it false. Then you are able to actually test what it is that you think you're testing. Okay, hope that helps.
Yeah, absolutely. There's some fantastic information in there. And I really want to say thank you for taking the time to sit down and talk to us about all of this. We've answered everyone's questions so far, but we do have just a couple more minutes left in the hour if anyone's got some burning questions they want to get in right before the end. But did you have anything you wanted to say before we sign off?
No, thank you all for taking time out of your pandemic to listen to me yammer this afternoon. So everybody be safe out there. If you're on the coast, get up to the second floor. If you're on the West Coast, then put on your Nomex, and wherever you are, just stay safe.